All right. Welcome back to the Progressive Rehab and Strength Podcast. I'm your host, Dr. Rory Alter, head clinical coach here at Progressive Rehab and Strength, with my lovely co-host for this unit on the Progressive Rehab and Strength Podcast, Dr. Breanne Maruca. She's a clinical coach here at Progressive Rehab and Strength who specializes in pelvic health. So we did an episode previously, our last Saturday episode on functional anatomy of the core and the pelvic floor. So if you have not listened to that episode, it is an eye-opener for so many people because we are so unaware of our insides. What you don't see, you don't care about. So please go listen to the functional anatomy episode with Bree from last Saturday. But this is Bree's first 10-minute tip. Well, we actually did a 10-minute tip. We recorded it in advance on the Kegel. And
it's not 10 minutes.
We decided to not do a 10-minute tip with that one. I didn't even set the timer because the Kegel needed more than 10 minutes. So that should be coming out next Tuesday relative to this episode. And by all means, please go block out 40 minutes to listen to that one because that is a really awesome episode as well. But in this 10-minute tip, this is going to be Bree's first time under pressure on the clock here. It's 10 minutes. If you aren't aware of what our 10-minute tips are, we introduce the topic and then we set a timer and talk about it for 10 minutes. And when that 10 minutes is up, sometimes we keep talking, but sometimes we stop. We never know. We try and keep them to 10 minutes. So this episode is all about pelvic and abdominal issues that affect people both inside and outside of training, just things that the general population experiences and thinks is kind of normal or is unaware that there's something more out there that can help you. So, and Bree's favorite saying and my favorite saying, one of my favorite sayings is everything, just because
something is common.
There you go. It doesn't mean that it's normal. I was going to say common, typical, normal. Like just because something is common, like people experience urinary incontinence or people have C-sections and then have back pain and, it's pain with intercourse. It doesn't mean that it's normal. So we're going to talk about all these pelvic and abdominal issues that people experience, whether or not it's inside of training, because we think that pelvic issues there needs to be more awareness of them, and that pelvic health physical therapy can help you. So
and programming too, and appropriate training. Like that doesn't mean you have to stop, because I cannot tell you how many times women say, I was told I can't, shouldn't, couldn't like lift or Valsalva or this or that. And it's like, that's the best thing you can be doing for the system to help
work properly.
And to help stronger. To help manage, but also to help prevent exacerbation or worsening or problems in the future. So
and also just to make this very, very bold and important statement is that pelvic floor issues do not just affect women. We tend to think that urinary incontinence is a dysfunction of the female, but it's not. Men have it, but if you go back to our functional anatomy, when we talk about the pelvic floor and how many holes men versus women have, there's more holes in the system for females.
It's true though.
Which makes it a little bit weaker. The more openings you have, the less
vulnerable the
more vulnerable something is. And also, we didn't talk about the structure of the urethra for men versus women, and how gravity affects urination for men and women. And then also, men don't have babies, women do.
And their pelvis, the structure of their pelvis is so much smaller. So it just in more narrow. I don't want to say so much smaller, but the structure, their structures are just different. Which tend to make their system just more optimal in a different way. But
so that's why we tend to see that pelvic floor issues affect women more than men. But that does not mean men don't experience pelvic floor dysfunction. So what we're going to do in this 10-minute tip is talk about all of the most common abdominal and pelvic floor issues that you might experience inside or outside of training. And that training, just because you have these things, does not mean that you can't train. In general, we always can keep you training by just managing training a little bit better and addressing the issues in any way that they need to be addressed. So with that all said, whew, I'm gonna start the clock, Bree. Let's start. Okay. Well, we'll go like
pressure's on.
Let's go like top to bottom, abdomen to like the bottom of the pelvis in terms of issues. All right, here we go. Just like down and dirty, what the issue is, what it is, and move on to the next one. All right, 10 minutes. 3, 2, 1.
Go. So first off, with males, the most common issues that we tend to see, or that I tend to see, at least in the clinic and with clients, first off, are hernias. I mean, I think men are most commonly susceptible to inguinal hernias, umbilical hernias, just for the simple fact that men tend to lift heavier shit and lift a lot more heavier shit. And that's just what it is.
I mean, back in the day, they did more manual labor. Yeah. And they did more manual labor. I mean,
yes.
At the end of the day, we just have to look at how people function in society, how societies function, and what people's roles have typically, traditionally and historically been. You know, women
or manual.
And this is not us. This is not us.
We're not
being gender roles or whatever. It's just how it has been.
It's just is what, like this is just what, So, umbilicals, and what that is, or sorry, hernias, what that is a disruption in our tissue, which when I get to diastasis recti, these are two completely different things. Yes, they're caused by some similarities, but hernias are an actual disruption or I don't want to say a cut in the tissue, but if you picture like getting a hole in your shirt, like that is what a hernia basically is. It's a disruption in that tissue. And depending on how big the disruption is, or how much pressure is being pushed there, et cetera, you could have more protrusion of internal tissue coming out of that opening, which could be very painful. Obviously it doesn't look great, but like more so it's discomfort and can actually cause severe problems with cutting off blood supply to that tissue and causing more severe problems. So hernias, diastasis recti, which again is caused similarly by pressure, something, internal pressure being pushed to a tissue that is, I don't even want to say weaker, but a path of least resistance, which connective tissue can be that path of least resistance. If you look at our functional anatomy podcast, that linea alba, or the connective tissue separating the two, or connecting, I guess not separating, but the connective tissue connecting the two rectus abdominis muscles that goes from the ribs down to the pubic bone, basically it's pressure being pushed into that tissue, and it creates like a coning or doming or bulge in that tissue. Again, not that abdominal contents are coming out of the tissue, but they are pushing against that tissue. So almost if you think of like a balloon with a weak spot in it, that it like is kind of pushing.
We typically see that diastasis recti happen when the abdomen starts to expand.
Yes. Yes, very much so. So men, just because you're not, like, we usually hear that with pregnant women, because it's a very significant time of belly expansion, continuous and progressive belly expansion. But same thing with men, if you have a beer gut, or you've whatever the case is, you've had some changes in that abdominal area, that's definitely more common. Again, doesn't mean that it has to, you could have a 6-pack and you could still experience diastasis recti because of pressure mismanagement or fatigue and programming issues. So we'll get to that in a little bit, but
we have a whole episode on So all these issues that we're talking about in this awareness episode are, we have
specific
episodes coming up. So by all means, stay tuned for our episode on DRs and hernias, because we are going to dive deeply into them. So next up, that affects both men and women, are
hemorrhoids. And so hemorrhoids, again, because you don't usually see them unless they actually are protruding out of like the rectum area. It's like, what is a hemorrhoid? I know it's a word and it hurts and I don't like it when I have a bowel movement, but what
are some symptoms of, so that people who, like, they might not even know that they have a hemorrhoid?
So painful bowel movements is usually one of the main symptoms. You can have tissue protruding out of the rectum. So after you have a bowel movement, or you're lifting and you're pushing, and if you're not performing the Valsalva correctly, you're pushing pressure or bearing down into that pelvic area more, you can have tissue that actually like a bulge that comes out of the rectum. You can have dry itchiness, like in that rectum area, that just feels dry and like you're almost like your underwear itching it or something. You can also have pressure in that area and feel like you have to poop when you really don't have to, or you don't have to go as much, or it's a strong urge to go. And that's just because what a hemorrhoid is a blood vessel that has become weakened and creates, again, like a bulge in that blood vessel. And, it basically takes up space in that rectum area and can push on the sensors in your rectum that gives you that urge to go to the bathroom. Mm-hmm. Or again, when stool comes down into the rectum, it actually pushes into that, causes pain, et cetera, et cetera.
Oh, complicated. But anyway, you can lift with hemorrhoids. It's just, addressing when your symptoms start to arise, what intensities or volumes. Usually it's related to pressure mismanagement or fatigue.
Yes.
And that's when you can't, and once you're fatigued, you can't manage your pressure appropriately.
Yeah. So I would even say too, that with hemorrhoids more specifically, it's absolutely linked. I think more linked to that. And I see that, but I also see even more so when people are performing their breath holding correctly. So they're actually bearing down and pushing pressure, increasing and pushing that pressure.
Yeah.
Yes. And that's, I think, I see that more. Or even if you're having bowel movements outside of training, you're having a bowel movement and you hold your breath and it's like a, blood vessels are popping, your eyes are getting red.
They're really trying to get that shit out of you.
But so the next that does affect both men and women is urinary incontinence. Or just, I guess, urinary symptoms in general. So that doesn't just mean urinary incontinence or leaking of urine when you don't want it to. That also includes urinary urgency. So when you're like, I got to go and I got to go now. And if I don't go now, I'm going to pee my pants. Urgency, frequency means you're going more than like every 2 to 4 hours. So you are going maybe every half hour, every hour, or in training, you're going multiple times. Say like an hour or 2 hour training session, you're going to the bathroom before you train, then in the middle of training, and then again in the middle of training, then after. That's frequency of urination. And then also incomplete emptying, where you feel like you don't fully empty your bladder. Or you have dribbling afterwards where you like pee and then you're like, oh no, like a little bit more came out after you kind of finished up. And obviously you can also have pain with urination too, where it's starting or stopping the flow of urine, or in the middle you have pain. That can be a muscular or dysfunctional problem, or a inner core, can be caused from inner core dysfunction. Next is also in that pelvic area, constipation, problems with bowel movements. So constipation, pain with bowel movements, again, incomplete emptying, or that severe or significant urgency and frequency where you're not able to let your bowels fill up and then fully empty when it's time to do that. In that area as well, for men and women, we also have pelvic pain. And I can tell you that I would bet to say that men and women both experience pelvic pain, like they both equally experience it. Women, it's much more addressed, I think, because or just more commonly, you're more commonly aware of because of seeing the gynecologist. Painful intercourse, pain with gynecologist exams, pain with tampons, any of those things, discomfort or pain in that area, definitely symptoms we can experience. Pain in the tailbone, or with bowel movements, pain in that tailbone area. But with men, again, especially the young population of like teenage to like early 30s, 40s, like that like age range seems to be a very common age for men to have pelvic pain, and it to be either just brushed over and the doctors are just like, oh, we don't really know what to do with this, so like just good luck. Or they get I've seen a lot of interventions where instead of looking at the functional system, it's more so involved where they say, well, we got to do injections or spinal stimulator or surgery, or they don't really know how to address it, or even consider that it could be a musculoskeletal neuromuscular involvement. So very common pelvic pain, painful erections, things like that, very common in men. But I think you don't see it being talked about or addressed as much as with females, because I don't know who wants to talk about your, like any of that.
And
like
also,
in general.
It's interesting because, and I'm going to make a generalized statement, correct me if I'm wrong, most pelvic health physical therapists are female.
Mm-hmm. And men do not want to, like,
it's like,
it's embarrassing.
Also, like, one of the other pelvic dysfunctions we're going to mention is erectile dysfunction.
Yes.
And like, oh, that's our timer, but we'll just keep.
Oh no. We better
hurry. I know. We're almost done.
Yeah.
You know, I don't know, like, there's a stigma around it, you know, like women, like you said, women go to the gynecologist, they have babies, you know, we become very vulnerable publicly, like, you know, in front of people who aren't our significant others. And so because we're always being poked and prodded in that region, we talk about it. But men aren't always poked and prodded in that region, and they don't deliver, and they don't have annual gynecological exams, you know? So, and because pelvic health physical therapists typically are female, men, there's like some type of taboo to get it addressed.
Yes.
And like, like, I'm making a blanket statement here, but if I were a man, I would probably not want to talk to a female about my penis not working correctly, you know? So here's the deal, guys. If you're experiencing erectile dysfunction, you don't necessarily need a pill to fix it.
And can I tell you, in my experience, again, obviously I don't see every single male that, you know, has ever had erectile dysfunction, but when we look at the reason for why we have erectile dysfunction, usually it's some blood flow involvement and et cetera. Well, if muscles are squeezing around like your blood vessels, like, well, it's kind of clamping off the hose. So just going back to this, yes, medication for some people is the answer and what they need, and that's perfectly fine. But I would bet to say that for the men that I have worked with that have had pelvic pain with erectile dysfunction, et cetera, most of their problem was a musculoskeletal problem. It was not a neurovascular problem, or like, you know, so
or the neurovascular problem was a result of the musculoskeletal issue. Because like you said, the clamping down and whatnot. And it's the same thing with pelvic pain, you know, like we can get pain from, you know, like when you work a muscle really, really hard, right? So you do like a million bicep curls, and then your biceps, like, you can't straighten your arm because your bicep is so pumped, and then it's like super sore the next day, and so you still can't straighten your arm, right?
Played cornhole for like 5 hours on a Saturday.
So that's why, you know, that can cause, when you have an issue where the muscles are just chronically contracting and are always fatigued, tired, and sore, that can lead to issue, you know, all these pelvic health issues can happen because of that. So
and same thing, a little bit similarly with females, you see a lot of symptoms with, I see a lot of symptoms with vaginal dryness, where women have a hard time becoming aroused and orgasming. I know this is like getting beyond the powerlifting, you know, realm, but the reason why we're mentioning all of these is because whenever I do a free call with someone, or I am working with someone with rehab coaching, or that consulting with them, I screen through all of these other symptoms, because it's important to know kind of how involved maybe the system, like what involvement there is in what part of the system. Looking at all of these symptoms, if you're experiencing these other things, just because you don't have sex and lift barbells at the same time, you know, it doesn't mean that those aren't correlated, or could be correlated, or all involving the same system, is what I'm trying to say.
Yeah,
So,
I'm gonna get super personal here, because I think that this is, you know, I think it's important to share personal experiences so that people can relate and don't fear sharing this information with their clinician or coach. So you know, we didn't mention abdominal surgeries, but and we'll talk about this in the connection between the hip and the low back and the pelvic floor. But I had a C-section, and that is an abdominal surgery and pregnancy. And when I returned to intercourse with my husband, I was experiencing what I thought was severe dryness and causing like almost like an Indian sunburn. And I was like, it is so painful to have sex. And, you know, it was like lube would help a little bit, but like it was just this Indian sunburn sensation. And I thought it was dryness, but it was actually tension in my pelvic floor, because my pelvic floor was compensating for the weakness in my
core
in response to the pregnancy and the C-section. Yeah, thankfully I don't have I saw a pelvic health specialist in person, and you know, due to all the help that you gave me remotely with my scar very early on, I don't have significant adhesions or scar tissue that's affecting my core, but I was super weak, and when she was doing this internal exam, and most pelvic, like when you experience these types of dysfunction, like we've said this in our functional anatomy one, like if your symptoms are only in training and we've addressed the training scenario and your symptoms are relieved, you don't necessarily need an internal exam. And I think that's like, it's really important to know that you don't always need an internal exam. And I think people fear talking to a pelvic health physical therapist because they don't want to get up close and personal like that. But
and also too, if that's not something you're comfortable with, I always tell people, like, remember, our emotions and everything affect our muscle tension. So if we are fearful, or we are like, I don't want to do this, I don't feel comfortable, your muscles aren't going to relax. So there is the option of external assessment of those muscles. Physical therapists can talk you through, hey, if you don't feel comfortable me placing my hands on, assessing those tissues manually, I can talk you through you assessing those tissues manually, and we can get somewhere. So I always say this, like, we'll meet you where you're at, and don't let that deter you from getting the appropriate help, and addressing these symptoms appropriately, most appropriately, because you're afraid of, or it's uncomfortable or whatever. That's our job, is to make the situation meet you where you're at and make you comfortable and progress from there.
Yeah. And so just to kind of tie in what I was saying about the internal exam, what I thought I was experiencing was dryness, but it was actually muscle tension. Because when she went in and she palpated my pelvic floor muscles, I was like, that's the symptom I'm feeling. That it feels like the dryness sensation. And it was actually severe muscle tension. And the only way I could describe it was like an Indian, you know what an Indian sunburn is, when you like turn your skin. Yeah. Yes. Oof, man, it was terrible. And that's the only way that I could describe it, but it wasn't drying. It felt like dryness.
Yes. And you have so many nerves in your pelvic bowl, that muscles then pulling on nerves can give you, like, there are so many sensations that you can describe. Like, think of pressing on a trigger point in your neck, or tense muscle in your neck. There are different sensations you can feel. It could feel like a headache. It could feel, burning, stinging, sharp, achy, all those different feelings. And the same thing in the pelvic floor, except it's much more intensified because we have so many nerves in that area. So it can feel like shards of glass. I mean, I'm not saying this, but it can feel like a hot metal poke. Patients and have explained and expressed this. It feels like a hot metal poker, shards of glass, a sharp fingernail. Like, people say, do you have fingernails? Like, I'm like, no, my nails are short. Like, it's not my fingernail. It's just, you have a trigger point and you have tense muscle tension. So,
yeah. So I think, the reason I wanted to share my experience was because,
thank you too.
It just, you don't, like, we are so unaware of what is going on in there, because we're not supposed to be aware. If we were aware of, like
every little thing,
it's like, we're not aware of our eyes and we're not aware of what, like, our organs, because if we were aware of them, like, we would get nothing done. We wouldn't be able to
be crazy.
Yeah. And like you said, that area is very filled. It's like a highly sensitive area, because I mean, think about the incredible amount of joy that area can bring us also, so if you are experiencing, I think the only thing that we didn't cover was the hip and like SI pain. So
basically pelvic girdle pain, any pain within that pelvic bowl. So front of the pubic bone, whether that's in the back by the SI joints, which again, other episodes go further into detail on these structures and kind of involvement, but in the front of the pubic bone, in the back by the tailbone, down by the, tailbone, down lower, like rectum area, and hips, anywhere in that hip area.
And your low back too. And
yes,
we have
low back for sure.
Like we're having a whole episode on the SI and low back and hip pain and the connection to the pelvic floor. But if you've done like everything that you can for addressing low back pain or hip pain, and you don't want to have surgery, or you had surgery and you're still having symptoms,
because that's super common.
Yeah,
because it's not addressing the
it could
root
be
of the
your
problem.
your hip, your pelvic floor. And just to kind of tie in my experience with pelvic health physical therapy. So one day she was doing some manual work inside, and she started to work on my internal rotators of the hip from the inside. Mm-hmm. And I was like, wow, that is like the relief that I've been trying to get in my hip for so long.
Yes.
And so it's just like, even though it was my hip, it wasn't my pelvic floor, but she went in from like she was able to address it from the inside out versus the outside in. So that was just like a really cool experience for me as a physical therapist.
To like connect those things and be like, oh,
yeah. So, but we're way over our time here. And we've addressed all these things, and this is kind of like a trailer for what's to come this month. We're going to be talking about all these things. The only thing that we're not really going to be talking about. Oh, we didn't talk about prolapse.
Oh, yes. Oh my goodness. Quickly. Okay, very quickly. And again, there's a whole episode going to be diving into this, but prolapse is basically any of the internal organs. So whether that's the bladder, the vagina, and your uterus, or the rectum, again, so men have bladders and rectums, but in male or female, it's pressure, heaviness in the pelvic floor area, vaginal rectal area, feeling again a bulge or like itchy dryness, like in those openings that you feel like, or pain. I mean, any of those symptoms, especially most people notice those after like a long day on their feet or training sessions, or somewhere again where there's more fatigue involved, or you're gravity dependent for a longer period of time. But those symptoms can then lead into other, or not even symptoms, but those that dysfunction can lead into other dysfunctions like other bladder symptoms, other bowel symptoms, other pain symptoms, etc. So we're all connected. Basically, to sum this episode all up, we're all connected. There are many things that we can experience. Again, just because they are common does not mean they are normal, and they can happen inside of training, outside of training, or both. And that's where finding a specialist to, find the root of your problem and put your pieces of the puzzle together is super key in successful training, prevention, management, etc.
And don't be afraid to see a pelvic health specialist. And if you're seriously, I cannot say this, I think women are more likely to speak up. There's a subset of women who will never say anything. But men are going to definitely be less likely to seek help for these types of things, especially the things related to their penis. Please do not suffer with these things. They are common, but they are not normal, and there is always an answer.
You do not have to live with them. And
exactly.
Yeah. And again, that's what with PRS, like why I love that, again, fate has brought us together, because it bridges that gap between this fascinating world of like our bodies and our function, and then taking it into the barbell world and exercise world, and really just bridging that gap between the two, which I think, I mean, obviously I live in a small town in Pennsylvania, but I don't know of many people that have that resource available to them to bridge this gap. So please ask us questions. Please contact us. Let us know, because this is why we're having these episodes.
Like, you don't have to suffer with these things forever, and you also don't have to stop training when you have these things. Even though traditional clinicians, practitioners will tell you, don't. They'll worsen it, which is not 99% of the time is not the case. With that said, we went over, but we always go over with these 10-minute tips anyway. Thank you so much, Bree. And you guys can connect with her through the information in our show notes. You can book a free call with her if you have a free call or free consultation if you've got any issues that are going unresolved and you've been told not to lift. Bree's your gal. So we will see you guys next time on the podcast to go over all of these things in depth. All right, that's it. And thanks, Bree. Bye for now, guys.